A few things that I wanted to make sure I say this to every group is, first of all, I want to make sure that you guys understand that you are the clinical cornerstone, is what I call it, the clinical foundation of the practices. And so that's one reason that it's so important that we have these types of sessions. But also, I just want to make sure that you feel acknowledged, that we acknowledge you to say how important you are, and thank you so much for what you do, and for a job well done. And doctors continue their medical education. You know, they get CMEs, and there's CEUs that other healthcare providers have to gather and turn in. Well, we want to provide these types of forums for you as a learning forum, as some way to increase your knowledge base. And so if you have any suggestions for us, we want to have these on an ongoing basis. So any suggestions, please, would be greatly appreciated. What do you need? What would help you in your job? What would help you be able to do your job better? Is there a way we can do it in a more effective manner? So just let us know. And we have two parts this morning, or is it this afternoon now, isn't it? We have Dr. Nancy Stevens, who's going to be talking about medication calculations, which is always a good refresher for everybody, and very important. And then Marianne Bailey and Cassidy Bass, is that right? Okay, thank you. Is going to be talking about eCHART and how we can consistently enter in the medications into eCHART. So I won't come back to introduce you guys. I'm going to let Nancy start. But I do want to say to those that are remote, if you will be sure and send us a sign-in sheet that's dated, and also a copy of the two follow-up quizzes that we have. It's one on medication and one on the the eCHART piece of it. Okay, well, thank you very much, and I'll turn it over to Dr. Nancy Stevens. If they have a question, let me get the mic to them.
Okay.
Where's the mic?
It's usually on the thing right there.
Where's the mic? Do you
See
guys
right
see
there?
the microphone?
It's right there. Right there.
Oh, I see it. Thank you.
Good morning. Are y'all ready? Have you got your Christmas presents bought? Okay, good. So don't go to the mall this afternoon because I'm going to go, okay? I was there last night and I got so lost. And I went there to go into a store, and it's called Justice. Y'all know what Justice is? I had no idea what Justice was. But I found it, and it's like, wow. We didn't have any of that stuff when I was growing up. So Sandra just asked me to go over some medication calculations, and I just think that if we keep this really simple, this is the way I learned how to do medication administration or calculations, and as long as you keep it just really simple and don't try to make it complicated or anything. So let's just start off with a couple of problems. I know these are easy peasy, but my background, basically, I have been at Erlanger for over 30 years. Marianne, how long have you been here, dear? Oh, okay. I thought you'd been here longer than me. All right. So we have 50 years of experience between us. But when you stop and you think about giving medications, and there's a lot of medications that I don't give real often. There's a lot, and I still practice. And so if I don't know what I'm doing, then what I do, I basically just go to somebody else and say, please check this with me, all right? Because there is no way that we would ever be able to remember everything that we need to remember. Now, in my opinion, I say that once you get over the age of 40, that your rote memory, and those are the little index cards in your brain that you flip through when you're trying to find out an answer. I think mine are all used up, so I have to rely on what I knew before. So there you go. All right. Real simple. What has your doctor ordered? So your doctor has ordered Keflex 500 milligrams. But you go to your cabinet, and what strength of Keflex do you have on hand? And what you have on hand is 250 milligrams. So I know that's a really easy calculation, but let's just ask the question, how many capsules do you actually give the patient? So let's work this through. Okay, let's set it up. And this is the way, once again, the way that I was taught. This is the way that I teach. So I set up an equation. On the left-hand side is what did the doctor order. And underneath that is what do you have on hand. And then equals, we're going to cross multiply. On the right-hand side on the top is how is this drug supplied over X. I think that's backwards. All right. So basically what we have done is how the drug is supplied is 500, and it's over 250. That's how it comes. How many pills is 500? We don't know, so we made it an X. 250 is in one tablet. So we multiply, cross multiply, and we come up with 250x equals 500. Divide each side by the number that is in front of the X, right? So we divide this side by 250, we come up with 1, and we divide this side by 250, we come up with 2. All right, so our answer is we're going to administer 2 capsules. Does that make sense? All right. Okay. Your patient takes 150 milligrams daily, but it is only available in your cabinet with 125 milligram tablets. How many tablets do you tell your patient to take daily? Okay, so what did your doctor order? What did he order? 150 milligrams, right? Okay, so, but we only have available 25 milligrams, so we put 150 over 25 equals X over 1. Does that make sense? Okay, so this is what it looks like. 150 over 25, cross multiply X over 1. So you have 25x equals 150, so divide each side by the number in front of the x. So 25 on the left-hand side equals 1, and then 25 divided into 150 equals 6. So your x is equal to 6. Okay? All right. So the doctor has ordered Solumedrol, 80 milligrams, and you go to your cabinet, and what you have in your cabinet is that you have Solumedrol, 40 milligrams per milliliter, or you have Solumedrol, 125 milligrams per milliliter. And so basically you could use either strength. It does not make any difference which strength you use. It depends on what you want to do. So let's set it up with the 80 milligrams, the 40 milligrams first. So what did the doctor order? He ordered 80 milligrams to be given. What do you have on hand? What I have on hand is 40 milligrams. How does the 40 milligrams come? 40 milligrams comes in 1 ml. So here's your 1 ml. I don't know how many mLs the 80 will be in. So let's cross multiply. 40x equals 80, and then x, divide each side that's in front of the x by 40. So this will be 1, and this will be 2. So x is equal to 2. Y'all okay with that? All right, so let's say we're going to use the 125 milligrams. So let's set that up. So what if we set up the 125 milligram per milliliter? So this is completely, so what your doctor has ordered is 80. What you have on hand is 125. And so you have your X is here, and then your 125 is in 1 ml. So cross multiply. 125x is equal to 80. You divide each side by the number in front of the x. So if you divide this side by your left-hand side, you come up with 1. And if you divide the right-hand side with it, you come up with x is equal to 0.64 mLs. Let me stress to you how important it is that when you take your multiplication out, or whenever you, if you set up anything you set up will come out, you can use this formula, right? It's very important that you put this zero in front of your decimal. If you don't put that 0 there, then somebody may not see the decimal and may think that you want them to give 6 milliliters or 64 milliliters, right? And I told this the last time I was here. I was orienting a new nurse in the emergency department, and a physician wrote an order for Valium 50 milligrams. And so I saw her look at the order, and she went over to the medicine thing, and she started getting out multiple vials of medicine. Please know that our medicine basically is packaged for our convenience. Now, back in the day, we had multi-vial medicines, but we don't anymore. So when you have to get out multiple tablets or multiple vials, I want you to stop and think, am I sure that I'm correct on my calculations here? So as she was getting out 7 vials of Valium, I just sort of said, what's the normal dose of Valium? And she said, I don't know. And I said, well, you need to look it up. And so she looked it up, and she said the normal dose of Valium, it says here, is 2 to 10. But this physician wrote an order for 50 milligrams. And I said, then you need to call and verify the order. And he says, oh, no, there's a decimal behind the 5. It's only 5 milligrams. But so that's why it's really important to make sure that if you have a decimal, that you put a 0 in front of it or a 0 behind it. And if you don't think the order is right, then verify what the order is. Try to find out what the order is. All right. The provider has ordered some cough syrup that's 125 milligrams per 5 mLs. He wants the patient to take 375 milligrams every 8 hours. So how many milliliters of this cough syrup are we going to have our patient take? So let's set it up in a ratio proportion, all right? So what your physician has ordered is 375, and we don't know how much liquid it's in, but what we have on hand is 125 in 5. So let's cross multiply now. So 125x is equal to 375 times 5. That's your cross multiplication right here. So then we have 125x is equal to 1875. And then when we divide each side by 125, we come up with x is equal to 15. So we know that the patient needs to take 15 milliliters of cough syrup. How many milliliters is there in a teaspoon? 5. 5, right? So we're going to tell our patient to take 3 teaspoons, right? Okay. Do y'all have any questions about that at all? Y'all okay? Any problems with those? Okay. Marianne?
While Marianne's getting up and getting ready, I'll tell you a story. So Dr. Will Jackson, our chief medical officer, his wife sent him a text, I think this was Thanksgiving, to stop by the store and pick up some meat because they were having company come in and wanted to have sandwiches. So she sent him 0.5 pounds sliced roast beef from the deli, 0.5 pounds ham, and 1.0 pounds of turkey. Well, she didn't put the 0 in front of the 0.5. So as we know, 0.5 pounds is half a pound. That's what she wanted. Sliced ham. Guess how much he brought home? 5 pounds. Yep, 5 pounds of ham and 5 pounds of roast beef and 10 pounds of turkey. So that decimal point, while yes, they gave meat away, but that decimal point, that 0, is just very important. Okay, that's my little story. That was my time filler for you.
Okay. Good afternoon, everyone. My name is Cassidy Bass. I am the ambulatory credential trainer at eCHART, and Marianne is over here with me. I don't know if you can see her sitting in the corner. She is our senior instructional designer. We both do ambulatory, so I know there's tons of offices out there, but it's just us. So we're very glad that Ms. Sandra McGinnis asked us to come speak, because we believe that documenting the medications correctly within eCHART is just as important as administering them correctly. So you really need to pay attention, and you need to make sure that you're documenting these things the correct way. So today we will discuss a few different things. So we're going to talk about medication reconciliation from outside sources. We'll discuss documentation of medication review, documenting clinical administered medications, which we call CAMs, documenting sample medications, and also documenting immunizations administered in the clinic. Okay. So the first thing we'll talk about is medication reconciliation. So when another source has a medication on file for the patient, you will see this red bar. I'm sure you guys see that quite often. So that red banner will appear at the top of the medication section. So this data can come from different organizations that may see the patient. It may come from the patient's pharmacy, or it can even come from the patient itself within MyChart. So what you would do with this is in the medication review section of the rooming activity, you would click that Go Reconcile button. So then you would see all of those medications. You would review that information that appears in that activity. You may add or discard medications by using those speed buttons, and you can see those right here. So any medications that are discarded, they will fall off the list completely. Any medications that are added will appear for the physician to review. So discard any of the duplicate medications. So sometimes you may have duplicate medications that will come in. If you see that, you may discard those, and you can add any of the other ones, and then the physician can go back and they can clarify that. So once you're finished with that, you'll hit the accept button. If you guys are in the system, you guys know that we use the accept quite a bit. It's usually in the bottom right-hand corner. So you'll click that accept button to add the reconciled medications to the patient's med list, and then it will return back to your last screen in the rooming activity. So just remember that medication reconciliation is very important for patient safety. You may also see those banners in the allergies section or the problem list or immunizations. So it will look the same, and you'll see that quite often probably, but you'll have those speed buttons to where you can just click add or discard if there are any duplicates. Okay. So I'm not going to demo the medication reconciliation because it's not built out in our training environment. Do we have any questions about medication reconciliation as of now? We'll go back to questions at the end, but okay. So the next thing we're going to discuss is the medication review. This is also a very important part in the rooming activity. So you will have the medication review section in the rooming activity, and you will see the patient's med list. You will have to go through and mark each medication as taking differently, not taking. You'll have those different options to click those buttons when you review that with the patient. So if the patient is taking the medication differently, and they give you that information and they tell you how they're taking it differently, and you mark that they're taking it differently, it will highlight, and you can see in the screenshot down here, it will highlight that the patient is taking it differently, and it will show how the patient is taking it. That will also highlight in the plan activity for the provider to see, and they can address that as necessary. Okay, and I'll go ahead and go in to Epic, and this is just our training environment, so we have a and I'm just going to pick a patient, and I'm going to go to the medication review. So here's this patient's med list. You would go through and confirm and discuss with the patient, ask if they are taking their medication, taking it differently. If the patient says that they are taking their Lipitor as prescribed, you would just click the taking button, as I just did, and it turns green. If they are, say, taking one of these differently, you would click taking differently, and you would get more information to fill in. It would open up. So it wants to know how they're taking their medication. So if they're supposed to be taking it daily, but they say they're only taking it, okay, let's just say two times daily. So if you add that and accept, then it will highlight. And just to show you guys, the provider will be able to see that in the plan activity also in the meds and order section. It highlights whatever you document in there that they are taking differently, it will highlight for that physician to see. Okay. So you also have the option to use the larger speed buttons at the top, where if the patient is taking all of the other ones, you could click mark unselected taking, and it will mark the other ones as taking. So that is an option also. If the patient reports to you that they are taking a medication such as ibuprofen, you have the option to add that medication. So you would click in that search box, and we say less is best, so it's best not to try to spell some of these medications. So if you just type IBU and hit enter or add, it will pull in and I'm just going to choose one of these for training purposes. You can accept, and it will show up with this little icon. It looks like a person with a bubble. So that means the patient reported taking that medication. Okay. Okay, do we have any questions on medication review? Okay. So the next thing we're going to discuss is documenting a clinic-administered medication. So the way you would know that a patient needs a medication administration is when you see this icon on the schedule and it looks like a little red clock. So you will see that in the meds due column on your schedule next to the patient's name. So what you would do is open the MAR. You can get to the MAR just as you can get to a lot of things multiple different ways. You can either open the MAR if you're in the patient's chart by going to the More button, clicking on the MAR, or if you're on the schedule, you see that icon, you can just double click on that icon and it takes you right into the MAR. Okay. You will then see this screen and we're going to demo the Toradol injection. So you will see a blue bar that has the due date or time link for the medication you need to administer. You need to click on that blue bar. Do not click on the new administration. We're not giving a new administration. We're giving that administration right there. So we need to click on that blue bar that it says it's due. You'll then see the information you need to fill out for the CAM. So you'll see that there are some required information such as the site that you gave the injection, the NDC number, the lot number. As you all know, you get those red hard stops saying you have to fill them in before you can go further. So that'll be the same for this. You'll have fields that you have to complete before it will let you accept. So once you enter all of that information, you also have the option, I don't know if you can see it in this screenshot, but there is a patient supplied box if you have an instance where the patient supplied the medication with them. They brought the medication with them. So you can check that if that is applicable. So once you're finished, you'll click the accept button. Okay. And then it will go back to the MAR and that blue bar turns green. So green in Epic is usually good. So green means good. So then it shows that it was given. Okay, so I'll go ahead and go in and just go. I'm going to go into our Fatima patient. Okay, so here's the icon that you will see. It is in the meds due column. So I'm just going to double click on that since I'm already on the schedule. It saves me a click or two. So here is my blue bar, and if you notice you hover over it, it will say click to document. So we're going to document our Toradol injection. Once you click that, that will open up, and of course this one says it's off schedule. But you will have to fill in those fields that have the red hard stop. So I'm just going to throw some stuff in just for training purposes. So of course you would not do this like I'm doing this. I'm just throwing stuff in here. Okay, so once I have added all of that information, I'll click the accept button in the bottom right hand corner and it shows up as green. So it shows up that it was given, it gives the date and the dosage. So it went from blue to green. So green is good. So we do not click the new administration button. Click the blue bar. Okay. So the next thing we're going to discuss is documenting sample medications within eCHART. So when the provider orders a sample, instead of seeing that little icon that we just saw, we'll see a blue dot on the schedule. So if you notice in the screenshot, you see the blue dot next to the patient's name. So on the visit orders report, you'll see the sample medication. The visit order report will show up whenever you single click on a patient. You get that report pane that shows up on the bottom half of the screen. If you don't have the visit orders report, you can easily add it. But that's where you'll find that sample medication. So if you can see the screenshot on the bottom of our slide, it shows the sample medication needing completion setting on that visit orders report, and you will click on not the medication name, but the sample med hyperlink right here. Okay. So once you click that button, you'll complete that sample medication information. So this would be, the provider would be the one ordering and giving them the sample medication, but you would document in here the lot number, expiration date, whatever is required, whatever you need to add in there from that sample medication. So if you don't complete this area, you will eventually get a message in your in-basket, and we all know we don't like lots of messages in our in-basket. We don't want it to overflow. So you would get a collect specimen message in your in-basket if you did not complete this section. But once you complete that, you would click accept. But sample medication paper logs must still be maintained. So I will show you that also within Epic. So we're going to use our Fred patient for this, if I can find Fred. Okay, so if you notice the blue dot on our schedule, if I single click on my patient, I get a report pane on the bottom half of my screen. I have different reports available for me. If you do not have the visit orders report, you need to go add it with the search box on the right-hand side. But I'm going to click on my visit orders, and if you notice, it says sample medications needing completion. I'm not going to click on the medication, the low pressure hyperlink. I'm going to click on the task hyperlink that says sample med. So once I click on that, it will want additional information such as the lot number, expiration date, and so forth. So once you have added all of that, and I'm just throwing stuff in here for training purposes. So anytime you have a search box that has like a magnifying glass, that means it's not a free text. You'll have to click on that and choose from the box that opens, the list that opens. So I'm just throwing something in here. It also wants to know if that medication information sheet was given to the patient. Yes, and you do always give that. That comes with that sample medication. So you would say yes. Okay, so that is how you document that a sample medication has been given. So do we have any questions on documentation of sample medications? Uh-huh.
The doctor hasn't ordered it.
Hold on. Just gonna bring the mic to you.
If the doctor hasn't ordered it on the computer, if they are just giving them out, because sometimes they don't have insurance.
Yeah, they will still have to order the sample medication in order for it to show up to document that. So it'll still need to be ordered and linked to that order. So,
While we're talking about that, the instructions on how to take the medication needs to be written on the box on the medication. And you can sign out the medication and you can write the instructions, but you cannot hand the medication to the patient because then you're acting as a pharmacy tech. Cannot hand the medication to the patient, so you have to get the provider to come in and make sure that that medication is correct, because I have seen where people have pulled medications and it was incorrect, and they would have given the patient the wrong dose, and it would have had severe negative end results.
Just wanted to add to her question earlier. The insurance doesn't play into samples because you can give patient meds out to anybody as long as the doctor's ordered them. It doesn't go under their insurance. They were samples, they were free given to Erlanger, so insurance doesn't play in.
No, I understand that. But my question was, like, if they are given a sample, but they are because
They cannot afford it.
Mm-hmm.
You know, and even if they have insurance, sometimes the insurance covers some, and they refuse to pay themselves. They say, okay, we're not gonna pay, because we did see few patients like that, like Trilogy, this is very expensive. So if the doctor is not ordering it, so we are just giving them out without the order, so we don't have to put anything in the computer?
No, you still can't, you have to have an order to give it out, and the doctor has to be the one to give it to them. Okay?
Okay. So the next thing we will discuss is documenting an immunization within eCHART. So the way you would document an immunization that you gave in the clinic is you would go to the immunizations activity for that patient. Again, like I said with the MAR, there are multiple ways to get to the immunizations activity. So if you're already on the schedule, it will probably be easier for you to just select your patient and open that visit orders report that we just talked about and find the immunization order and click the administer hyperlink next to that, and that will take you straight into the immunizations activity. If you're already in the patient's chart and you don't want to have to take clicks to go back out to the schedule, you can just open the immunization activity and click the administer button, and your immunizations activity will probably be under that more button unless you have started and added it to your left side. But we do have a screenshot down here on the visit orders. This will show up under procedures ordered this encounter, and it has the administer hyperlink that you will click. Okay. So once you click administer on, say, the visit orders report, you go into the immunizations activity, and you will have to hit another administer button next to the immunization. So we do have a screenshot, and it says administer, and it has a little syringe next to it. So once you click that administer button, you will have to enter the details about the immunization, such as the lot number, the NDC, expiration, the site, and all the other ones that are required with those red hard stops. Once you're finished, you will click accept. If you happen to be interrupted while you're entering this required information, you can click the accept as complete button. You have that option to save what you've entered so you can finish it later and you don't lose your work. But just try to get all that information in as soon as you can. Okay, and let me go back into Epic and find our nadir patient. So I'm going to single click on my nadir patient, and since I hid my little window shade down there, I'm gonna go find it and click it. Okay, so now I'm still on the visit orders report, and I see that here's our immunization that we need to administer, the Tdap vaccine, and we have an administer hyperlink right next to the vaccine. So I'm going to click on the administer hyperlink, and it jumps me into the immunizations activity in Nadir's chart. So now I will see under the incomplete administration the immunization that I'm going to administer today. So I will click on the administer button, and I have all these different fields that I need to complete before I can accept. So I'm just going to go through and throw some stuff in here for training purposes. And there are questions that need to be answered. And here is your accept as incomplete button if you should need it, but we are going to accept because I have entered in that information. And now it shows the Tdap under the administration history that it was administered on 12/19, which was today. Okay. You guys will, unless you're transplant, correct, you will document immunizations within the immunization activity. Anyone that works with transplant, they do their immunizations within the MAR activity. Okay, so everyone else will be doing them under the immunization activity. Transplant does their immunizations on the MAR. Okay, so do we have any questions about any of the presentation? It doesn't matter. So, any questions? Okay.
Are there any other topics Sandra mentioned earlier that you would like to see covered, whether they're eCHART related or just your practice related? Last time we had a couple suggestions. Labs was one of them.
Help me remember, Marianne, what were the suggestions, because that might,
I know we talked about labs, possibly in basket and some of the in basket messages. Got one suggestion up there.
Okay, so question, as far as, my provider who I work for, in the in basket, I believe. She has like a lot of, I wanna say, what is it, overdue resorts?
Yes.
So, how do we handle that? Cause I don't handle that. Or do I
Okay.
just need to click on it to hit done or
Okay.
click?
The overdue results should be coming to the nurse pool in baskets, not to the physicians. So it's an extra job you kind of have to do, and we do have tip sheets out there on these. You can pull them up and look them up. But most of the overdue results happen for one of two different reasons. One is the physician ordered it, and the patient just never went and had it done. So it truly is overdue. And on those, you just have to look in the chart to see if there's any results. If there's no results, you need to call the patient and say, did you forget to have your blood work done, or go for your x-ray or whatever procedure they ordered. So that's one of the reasons. The other reason is many times with our labs, the interfaces don't always connect. So if you ordered a CBC with diff and the company, LabCorp or whoever has it as a CBD with a CBC with manual diff or auto diff, and the wording is slightly different, when that interface comes back, it doesn't recognize that exact order, and it creates a new order. So it's a duplicate. So if you go into the patient's chart and you look for a CBC, and there is one within that same day, next day, or whenever it was ordered, it's a duplicate, and you just go into that one and mark it as delete as a duplicate. It'll ask you why you're deleting it, and it's a duplicate. It's very time consuming, we know, and those numbers should be cutting back because they've fixed a lot of the interface issues, but they're still going to happen. So those are the main two reasons. It could also be that the interface was down and you just didn't get a result back, and sometimes you have to check with LabCorp or whoever you sent your specimens to. Yes, ma'am.
So I work in an office with a lot of providers, and we all hop around and help each other. But we do chlamydia, gonorrhea, and trichomonas testing off the urine, and we have a lot of mix-ups where, because you have to put in that it is urine you're running like 4 or 5 times, and then you have to put in it's LabCorp instead of path group. And a lot of the times it mixes it up in the system itself, and it ends up creating a lot of issues and extra time it takes because the providers have to go back and re-enter the orders because they're having to put it in too many times.
Put a ticket in for that, and hopefully they can resolve that by having some standard fill-ins for you, or if not, they can add it to their preference list for a certain way. So
Where
we
would I
have to-
put in a ticket for that?
You can call the 8324, the tech line, or when you're on the internet, and I don't know if we can demo over here. Keep coming down under the umbrella. And we should have,
Right here.
yeah, eCHART support ticket. You can put one, click there and fill it in as well.
Okay, thank you.
You're welcome. Are you work at OB residency? Okay, I just kind of guessed. Talk to me later too, when we're done. Any other questions?
are there any questions? I know where East is out there as well. Is there any questions from any of the other campuses?
You'll have to unmute. I don't think so.
All right.
Bledsoe doesn't have
That
any
must be
questions.
it then.
Thank
Don't
you.
forget to please let me know what other suggestions you might have for this type of training. And also, and I wish I'd said this with the other groups, you know, I wanted a lot of different hats while I've been here at Erlanger. But I am Chief Nursing Officer for the practices now for Erlanger Medical Group. So if any of you would like for me to come, because I do want to rotate through practices, if you would like for me to come, please ask me. Then I feel invited. I'm not invading, So please let me know. Just send me an email at sandra.mcginnis@erlanger.org.
She's very serious about that. She
I
bought blue
am.
scrubs and everything
I
so she
did.
could come.
I have a lab coat and scrubs. So let me know and I'll be happy to come. And in fact, not just happy, I would love to come. I really would. And like I said, I'm coming around the practices. It will take a while, but I would love to be invited too. That makes me feel welcomed. Okay? All right.
everybody.
Well, anything else, Marianne, from y'all's end? You got it? Okay, well, we're finishing up a little early, so don't forget there's 2 quizzes. Put your name on it and the date, please. This is not past. This is nothing. It's just something to help you review and to make sure that that we have taught the material adequately. So it's more for us than it is for you. So please put your name and date it. And leave it back here at the back for us. And after that, you're free to go. Thank you very much.